Hey, I am Dr. Evan Gwilliam with Practicsync, and I want to talk to you about when to use 97110, which is the code for therapeutic exercises, versus 97530, which is the code for therapeutic activities. A couple things these codes have in common. They're both time-based and they follow the 8-minute rule that is outlined by Medicare. So you have to make sure that you understand that rule to know how many units of each one to bill. They both require functional outcomes. So you really got to focus on your patient needing some sort of functional gain. So you need to document functional loss, like the ability to do some sort of activity, and then some clear functional gain as a result of these two procedures. Now, 110, which is your exercises, to me is more of an intermediate code, meaning after the patient gets through their pain and those things, you would focus on this to restore their range of motion, to restore their loss of strength. And you might work on the patient with this and develop an exercise program that focuses on that and bill for that service for a period of time. Once you've accomplished a restoration of the range of motion, then you might move on to the strength. And once you've accomplished that improvement in the strength, then you can move on to the 97530, which is your therapeutic activity. This would be taking into account the fact that you now have restored those other single parameters. You have multiple parameters you're focusing on now, like coordination, balance, and those sorts of things. Let me give you an example. Let's say that you have a patient who's a pitcher, a baseball pitcher, and he's messed up his shoulder somehow. Comes in and you evaluate him and determine that there's a loss of range of motion in that shoulder and it's deconditioned, so there's some weak muscles. And the patient says that he can't play the way he used to play, like he's lost some ability to function with that throwing of a ball. So you devise a plan where you deliver some exercises that are stretches to restore that range of motion first, maybe reduce some contractures that developed there. And after a period of weeks, that's been accomplished. Now you focus more on the strengthening and you do some strengthening exercises. When you see those results, then you move on and provide help with a therapeutic activity. In this example, maybe you put together some sort of routine with the patient that's facilitating the use of the shoulder with multiple parameters like catching. So you might set up a trampoline against the wall at an angle and a ball, and you throw it and catch it over and over again. And you work with the patient directly one-on-one to review and to improve that ability to carry out that activity, that function. And that's an example of when you might use 97530 instead of 110. It's much more advanced. It incorporates multiple parameters, and it's usually an activity that ends with ing, like catching or sitting or throwing or something that's a little bit more advanced. So using these codes together at the same encounter might be a little less common, but it certainly could be done. It's just a matter of being able to clearly support each one separately and show for the first one a loss of strength or range of motion or something like that. And for the 530, a loss of the ability to carry out some activity, and you're specifically focused on restoring that activity, and you've documented that it's being restored over time, and you get those results, and when you've reached them, you stop doing the service. And that's how you might use 110 and 530. I hope that was helpful.